Thank you so much, Dr. Kute, for inviting me here to speak about my journal and also the publishing journey. With the permission of the esteemed chairs, first let me introduce myself. My name is Shalini Garg, and I'm leading a journal from Lancet portfolio, which is called the Lancet Regional Health Southeast Asia. So it covers 11 countries of the WHO Southeast Asia region, which you should not confuse with the ASEAN countries. You can look up for WHO Southeast Asia, 11 countries, if you are more interested in the regional studies. So our journal publishes general medicine and public health papers that are concerned with the regional evidence. So we publish everything, all topics from maternal and child health to clinical topics like transplantation, oncology, and everything else in between. So today I'm going to talk about just a little bit about how a paper goes through, what is the journey of a paper, and then I will be happy to have more questions rather than I speaking. I will try to answer more of your questions rather than talking myself. So yeah, so a little bit of introduction about our journal, then the journey of your paper, what happens after publication, and then of course Q&A. So as many of you must know, the Lancet group of journals, why do you want to publish with the Lancet? It's a renowned name in medicine, general medicine and health field. You are sending your paper not only for publication, but also for an expert guidance, because we have a panel of editors who will look through your paper and advise you, even if they are rejecting the papers, or they'll send out to peer review, who are experts in their fields, and they will advise you on how to improve the paper. So that is a process that is very rigorous, and I'm not saying that we can counter our unconscious biases, but pretty much we try to follow a strict protocol. Then you get personal support and service with the Lancet from our international team of editors who are experts in their own domain knowledge, and also publishing professionals throughout the peer review and after the review and publication as well. As you all know, Lancet journals have global reach and high impact, so we are certain that your paper reaches maximum number of readers and the suitable readers who want to read that paper. And of course, you are helping in improving lives on a broader scale if you are publishing with us. As you must know, Lancet was started its journey in 1823 as a single journal, and now it's a portfolio of 26 journals, each dedicated to a specialty topic. And now we have 4 regional health journals that cover the regional data. That was a very big gap in research and evidence collection. So this is where we have offices. In India, we have 5 offices. We work out of Chennai office, and if you're ever in Chennai, please feel free to give me a call and we can have a catch-up. So we launched this journal in 2022, February, and this is an internationally trusted source of clinical and public health knowledge dedicated to the region. We publish only online content. There is no hard copies, and it comes out every month. So we publish 12 issues per year. It's a gold open access journal, and so it's available to all for reading, although it comes with the OA publication fees. So we are a team of 2 editors right now, and we are hiring, and this is a good stage for me to promote my open vacancy. We have an editorial role open right now, and if you're interested, it's a full-time in-house editorial position, so you will not be able to do other jobs because you have to dedicate your time and energy in reviewing other people's papers. So yes, so far, any questions? I'm actually blinded with this light. I can't see any hands or faces, so please feel free. So I carry on with the journey of what happens. I know many of you, all of you might have published papers with data that you're collecting on each and every day. But the value of our journal is that from morning I have been hearing papers that and seminars that have been presented here. But to my, something that was very interesting was that the esteemed speakers were presenting data from other countries and concluding that it would also be applicable to Indian patients. So this is very interesting to me that nobody ever bothered to say that this is a data from a Belgian cohort or a Japanese cohort. I think we have normalized this, that what happens abroad will be applicable to Indian patients. And so nobody is, excited to research in this country. So that's the value of the journal now. If you do local research, we have a journal that will publish your research. It's not that we do not have data, we have excellent data. We just need to disseminate it into good research. So when you submit your papers with us, so it means that you are partnering with an editorially independent family of journals, which is committed to improving lives, increasing the social impact of science, and while maintaining higher standards of medical science. We treat every submission individually. And most of the research papers follow a similar path of submission, review, revision, editing, production, and publication. So that you should be aware of. It's not that we are treating one paper different from the others. It's a similar journey. So this is kind of a flow chart that you will see at the Lancet, that when a paper is submitted to us, either it's desk rejected. Desk reject means that I will check the paper and see whether it's relevant to the region, whether its scope is relevant to the journal, whether it's a novel topic, whether ethics have been followed. So some of the broader things that I will check. And if it's not, it's not suitable or it's not in the scope of the journal, I will reject it then and there without sending it out to the other editors. Now, if I do send it out to the editor, it will come to a meeting. The editors will check your paper thoroughly on some of the aspects, like whether this research has been published already or not. Now, it might be that it has been published in other countries, but the data are not available from India. Or maybe that it is only a single center, very small sample study. Or it could be that it's just an exploratory study, something that you chanced upon. You saw that, okay, vitamin D levels were very low in these patients. And you say, okay, so in this condition, vitamin D levels are very low. But if you take data from the general population, it might be that generally the vitamin D levels of the population are low. So that is why we need data from multiple centers or different regions or at least different cities or villages of the country. So after that, after the editor has collected all this information regarding the topic and regarding that paper, they'll come to the pre-review meeting where they will share the views, and then we'll see if we can give this a peer review chance or not. And then the paper will go out for peer review. After the peer review, the reviewers might say that the paper is not interesting and you can reject it on some grounds. We will send you the comments back. You can work on those comments and submit it to another journal, maybe a smaller niche journal that is very, very specific to your research area, your topic, or you can start working on that research in a more broader way. And so yeah, after you send the revised paper to us, it's accepted and published. So we are a family of 26 journals. Now, even if you send it to some other journal, the editorial team will take a decision and will transfer it to some other journal that's more suitable to that topic or that population or that setting. So, and it's a very collaborative, very, a very collaborative atmosphere. We have frequent editorial meetings in which we can discuss openly anything about these submissions. So you must believe that we never take your contributions or time for granted and aim to ensure that your experience is as seamless as possible. So we send out the papers to at least 3 reviewers, and if they're research articles, we will also send it to a statistical reviewer. And that's the most important one. If the statistical reviewer rejects the paper, your paper may end up being rejected. Now, what happens after we accept your paper? So, should your paper progress within the Lancet group, we will work in close partnership to check, put your findings into context, and also improve how clearly the message has been put out for the audience. So there's a big production team that will put your paper into style, and there's a Lancet style in which they will proofread your paper, they will check the figures and tables, and send you back if they find any problems. So it will be put in a very nice way so that the readers are interested in reading your paper. So these are some of the global platforms that we have where you can, these are the numbers, these are the actual numbers. According to 2024, we have annual visits, and you already know about the Lancet journals, how high they rank. We are just 3 years old and we have an impact factor of 5.5. So these are the indexes where we are, these are the databases where we are indexed. And there's something called a Lancet alert. So if you sign up to those Lancet alerts, you can actually get into your inbox whenever a new volume comes out. So this is a very good thing, and I will encourage you all to sign up for these Lancet alerts. We have a big following on social media, so you can your research will also be promoted through the Lancet, to the Lancet subscribers through social media. So this is the reach and impact of Lancet. We also now have Lancet podcasts. So our last podcast was on 24th March on TB elimination, and I had 3 experts with me who have discussed thoroughly on how and what and why of TB elimination. So look out for those podcasts and do subscribe. We also publish Lancet webinars, something that's very tough to get, and it has wide dissemination. If we have a collaboration into a series or commissions, so we can do Lancet webinars. And these Lancet webinars are very successful in promoting our advocacy work, commission work to a very wide audience. Very wide audience. These are as good as the original launch events. I'm not sure if you're familiar, if you have been to any of, there is a gender series launch event later this month in New Delhi, so that will be another such event. They're also publishing excellence webinars. You can register through them, and these are modules. They can guide you through the publishing process with the Lancet. So after the publishing process, I thought, let me take a look. This is generally we do when we go to a conference or an institute, we visit, we take some data to let the audience know what are the publications or how much that society is publishing in the field or from their institution. So this is the data on organ transplantation in India. And these are publishing trends from 2021 to 2025 till date. Okay, and you can see how many have we published in the Q1 journals. These are for 4 years. This is a 4-year data. And these these are the top journals that our papers go to. Is it clear? Can you see it? Okay, so these are the journals that you are sending out your papers to. Lancet doesn't feature anywhere, so and these are the papers that have been most cited in the last 4 years. So this is something interesting that you can work on. This is for your own thinking, something to provoke you, spike your interest in, and yeah. So that's my time, and thank you so much for patient listening. And I'm opening the floor for questions because I see that most of the research that has been presented since morning had very few publications from India or your own data. So that's something very interesting. I would like to talk about it because I think it's very important that you mention that these data that you are presenting are from such and such country or such and such population. And I would also want to know that how come you're presenting some data and that's concluded to be equally applicable to Indian population. So this is something that you can ponder upon, and I say this in every conference that I go to in India. And yeah, thank you.